They refer to presentations in pregnancy, and this is simply how the fetus is positioned. So most of them are positioned cephalic, or basically their heads down, especially as it gets closer to delivery. They may also, though, have a foot first or feet first. They may be across. They may in laying across. The first thing that would come down is their butt, and in transverse, they're simply lying straight across the uterus. In all of those cases, they cannot deliver in those positions. So these would require a cesarean section if they are term, and especially if they start having any contractions. We're seeing these more often, and probably infertility treatment is one of the key causes of multiple pregnancies. Um, and basically because more than one egg's released, which means more than one egg is available to be fertilized at that point. There are some problems that can come from multiple pregnancies. The mother, for one, is at greater risk of toxemia and any of the other complications that come with more than with one pregnancy. They are at greater risk of having difficulty breathing, urinary frequency. There's more pressure on the bladder, constipation. They're more likely to have swelling in at an earlier stage, heartburn because they're getting a lot of back pressure on the stomach. Um, and this could be for any number of fetuses. Typically, they will monitor all fetuses that exist. Um, and Typically, it's not extremely unusual that they will go to term for pregnancy. Even with twin births, a lot of times those will deliver at least a few weeks early. It's thought that the hydatidiform mole is probably caused from abnormally developing uh, genetic tissue following fertilization. It will look like a grape cluster on ultrasound. And a lot of times, whether or not it's malignant may be not determined until there's a tissue analysis of it. Um, but it is something you don't see it rarely, but you do uh, occasionally see it. I've seen it once or twice in the years I was in clinic. Symptoms are nausea and vomiting, vaginal bleeding. Um, Looking at the ultrasound, it'll look like that grape cluster. Um, and the uterus will grow in rapid size compared to what a pregnancy would be. The other thing that's really distinguished with these is the HCG levels will sometimes double daily, so they will go from a lower number to an extremely high number very rapidly. Um, Now, typically, that's probably the most information you need to know for the exam. But in one other note is these could happen with a uh, existing pregnancy, or they could happen with no pregnancy involved. There is a fertilization, but there may be no fetus. In treatment, they'll do a DNC. Um, Looking at the tissue, then based upon the tissue result, uh, what they'll do from there, they'll observe for hemorrhage. If it is cancerous, they do occasionally do that, but not real often. Then they will get chemotherapy. Breast diseases can range from mild to life-threatening, depending upon um, what type or what issues that you're running into. Um, they do require screening as it becomes age appropriate. Um, Looking at the mammograms is the most preliminary thing that they'll do. Um, Most common breast problems happen in women, but they could also happen in men as well. But any changes in breast tissue, lumps, bumps, indentations, nipple crusting, an inverted nipple where the nipple tends to go inward instead of outward, leaking of the breast, anything like that would be cause for needing to be further evaluated. Fibrocystic breast condition is something that's fairly common. It is benign or non-malignant. Um, in these patients will feel lumps or cysts, um, and it may be one, it may be several, maybe in one breast, maybe in both breasts. Um, they are typically tender. They may have pain that kind of shoots from them, um, and they typically you can feel them. Um, they are somewhat cyclic, so about mid-cycle, they will start to develop, become more uncomfortable. Uh, all the signs and symptoms will appear, and then after menses is over, a lot of times the symptoms will go away. So they're somewhat hormonally involved too. These are less of a problem after menopause because of there's no longer those fluctuations in hormones. Diagnosis of these are usually by palpation, but as a secondary, being sure they'll do a mammogram usually. Um, Cause we don't know why people have them. Usually see them between the ages of roughly 30 to 50. Again, hormonal changes a lot of what causes the variation. Ultrasound can be used once a lump is found to determine is it fluid filled, or is it solid tissue. Typically, solid tissue that doesn't go away is more concerning. Typically with fibrocystic condition, relieving the breast pain is the key point. And sometimes they may remove fluid. I really haven't seen that done much, but it would be needle aspiration if they do that. Wearing a firm supporting bra, avoiding caffeine. There's certain things that may predispose a little bit from developing that's caffeine. Anything with caffeine in it, which would be chocolate, tea, any of that kind of thing. Um, these are not malignant, but for whatever reason, they do cause a lot of discomfort. No prevention for it technically, just but monitoring would be required. Mastitis, typically this is seen after pregnancy with nursing mothers. It's inflammation in the mammary glands. Usually staph or strep is the cause, but it gets in the milk ducts, causes inflammation, and inflammation causes blockage. Milk stagnates and causes pain. Um, Typically, these are an infection-based gut problem. Symptoms are sudden pain, redness, breast may feel warm, um, too hot. They may feel doughy or kind of spongy, tough. They'll have discharge from the nipple. Running a fever is another key symptom, and they're obviously not going to feel good during all of this point. Um, it is usually um, the ones I've seen of this, they usually are very swollen, very miserable usually. Treatment is firm supported bra, heat to the area, progesterone cream, antibiotics, and very commonly oral antibiotics will be given here. Rest, analgesics, warm soaks. They don't typically have to stop breastfeeding um, as it improves. So prognosis is good. Usually it's something that goes away over a couple of weeks.